Hey guys, it's the Psych MP. Today I'm going to be talking about how I survived my first 6 months as a psychiatric nurse practitioner. And if you guys haven't subscribed already, please subscribe below. It helps me out, it helps the channel out, and you guys get quicker content. Alright guys, let's get to it. I think we've all been here. It's a new job role. It's kind of like when you were your first day as a nurse. You know, it's exciting, it's nerve-wracking, but you worked really hard to get here. You prepared as the best you could. The problem is now you're not a student, you're on your own. So now all these skills that you've learned, all the studying that you did, and now it all comes down to this. But I'm going to give you guys all my tips that I've learned in my first 6 months, surviving as a new grad psych nurse practitioner. And these should help you out. I wish I had these before I started, but hopefully you guys can take something from it. So number one is finding a good mentor or preceptor. It's really important, guys, to kind of establish that you have 2 or 3 people that you can consult with if there's a case that you're really unsure of. It's going to happen. There's going to be some complex cases that you're a little blindsided by and maybe you don't know what to do. So having someone that you can text or call, while there might be a psychiatrist or another psych nurse practitioner with more experience than you initially, everyone generally has a pretty busy day in the outpatient center, so it's going to be hard sometimes to reach them. Obviously you'll have them if they're available, but if they're not, it's good to have someone. I had 2 or 3 and I was able to contact them when I needed help. Especially these first 2 months, that's when I use them a lot more than maybe once every couple weeks. But now in the 6-month mark, I really barely ask for help, but if there was a case that I needed help, I would have them. Not to say that I know everything now, but over 6 months you just learn from these experiences. You see so many different cases, and that's helped me out a lot. Number 2, learn from your experiences. Every week, you're going to see 4 patients, 8 patients, 12 patients, 16, 20, no matter how many you see, you're going to be learning, and then you're going to see them in 2 weeks for a follow-up or whenever you see them, and you're going to learn, how did your medications that you prescribed help them, or how did it make them worse? And over time, you just keep seeing people over and over again. You kind of learn what medications you like to prescribe more. Maybe you see a higher efficacy in your patient population. You learn about the side effect profiles while you prescribe them. You learn things in school from books, but maybe you'll hear a new case or something that you've done that maybe induced hypomania for the first time, and you're like, oh wow, this really happened. So there's just so many things you learn from your experiences, and you kind of develop your favorite medication list, your go-to for this disorder, and really just going through it. It's almost like a trial by fire, but you worked really hard to get here, and no matter what, you have to be confident. Things won't always go your way. You might have a day when none of your patients are doing well, and you'll be like, wow, I don't know what I'm doing. And there'll be other days when all of your patients that come back for a follow-up appointment are doing much better. So it always depends and varies. So learn from your experiences. You'll only get better. 6 months in, compared to where I was my first couple of months, it's crazy how much better I've gotten. I'm a lot more confident. These are things that you only learn via experiences. You can ask questions all you want, but experiences really will get you there. Number 3, always critically think and think ahead. You need to always have a plan A, a plan B, a plan C. For me, I always know that when I have a patient that's coming back for follow-up, on my note, I'll write basically my plan A, plan B, plan C if the first plan doesn't work. And I want to have an idea so I don't get blindsided when they come back. So I'll read their note again, and I'll have like a little note saying, may look into this at follow-up appointment, or may look into starting this if this is not effective. You always have to have a plan A, plan B, plan C, and you critically think. You always challenge yourself. If you have a patient that responds well to the medication, think about what would happen if they didn't respond to this. What would I do? What if they were 60 years old? What would I do? What if they were 14 years old? What would I do? Think about the different diagnoses, different criteria. What if they were diagnosed with this? What would I switch the medication to? What would be the second line treatment, the third line treatment? You always have to think ahead. You never want to be blindsided by something. And critically thinking all the time about, what could happen next? What would I do with this? It will only get you better and become a stronger clinician. Number 4, Stahl's Prescriber's Guide. This has been the godsend for me. I use this all the time my first couple of months, probably the first 2 months. This will show all these different medications. It will show their dosing, how to dose it, how to titrate it, how to discontinue the medication, contraindications, basically medication interactions, even special populations for the elderly, renal impairment, hepatic impairment. And it's actually on the link below in my description. There's a SOLS Prescriber's Guide. I do recommend all clinicians, or at least especially new graduates, to have the SOLS Prescriber's Guide. It's really helped me out a lot. For me, if I didn't have it these first couple of months, you can look online and you'll remember dosages over time, because you'll prescribe a lot. But for me, even sometimes if I don't think exactly what might be the best titration, I use SOLS Prescriber's Guide a lot. Make sure to collaborate with your peers at your practice. If you're by yourself, that's going to be harder. But if you have another psych nurse practitioner, psychiatrist, if they're busy during the day, hopefully there's a time when you can shoot them an email, if you can meet with them. It's always good to have collaborations. I'm lucky in this practice. I can collaborate with a lot of really good psych nurse practitioners and psychiatrists if there's a case that we don't know, and learn from them. These people have different experiences. They might have tried other medications you haven't tried. So, learn from them, collaborate. Number 6, learn from your mistakes. It's going to happen. You're going to make a mistake. We're not perfect. Obviously, no one wants to make a mistake. One of the patients I had at one point, they had some, signs and symptoms of bipolar disorder, but they also mirrored a lot of just major depressive disorder. And I wasn't fully sure. They had really no psych history, so, initially I saw them on an antidepressant. I was like borderline. If they could have had bipolar disorder, they more MDD. I wasn't fully sure. Started them on Prozac. They got hypomanic. Ended up getting admitted. So these are things that I'm really careful and more wary. I mean, this could have happened to anybody, but there are certain medications that I get a little more wary to prescribe at times. But you learn from your mistakes. It helps me out a lot. Learn to set boundaries with patients. This is something as a new grad I think we will struggle with, especially myself. I'm guilty of it. I would respond to emails as fast as I could. I didn't want them to be waiting. It might be a side effect question, a medication refill. And while I could have waited till the weekend, I just wanted to get all of it done. The problem is you can burn yourself out really fast. That is something that I've learned. And it's not that you want to neglect the patient, but your day is already busy. So trying to respond to this email at lunch, if you can respond to it a couple of days later, I think responding to emails 24, 48, 72 hours is probably fair. Obviously, if it's a crisis and you do see the email, then probably you're going to send them to the nearest ER or crisis center. But for the most part, if it's just a regular question, it can wait. Definitely don't answer right away. Especially because these patients also, not to say that they'll become needy, they'll expect that you're going to respond to emails in 24 hours or 2 hours. And then when you get really busy and you can't respond to them anymore, they're not going to be happy. So kind of set boundaries, set limits, straight away. Number 8, keep asking questions. Learn from your peers, learn from your colleagues, ask questions, be a sponge. Also go to conferences. I've only been to one conference, but I learned a lot about the newest evidence-based practice. I met some other colleagues. I was able to network. I think conferences is a really great place to learn, especially as a new grad. You're going to learn so much from these things, and they're fun to go to. You meet a lot of people. Number 9, learn better time management. This is going to be something you're just going to learn on your own as you experience it. Whatever EHR you have, but you're going to learn how to flow your interviews better, learn how to flow your follow-up appointments better, just because you're going to get used to it. You're going to know what questions to ask, when to ask them, the appropriate time to ask them, get the important information, while also building trust and rapport. You're going to learn how to template your macros so that you can have pre-filled notes, and all you have to do is fill out the information. You're going to learn how, when you have an hour appointment or a 30-minute appointment or a 20-minute appointment, how to be quick when you're typing with them, trying to keep eye contact with them, try to be more efficient. Number 10, come in early, especially at the beginning. I come in 45 minutes early, and it helps me out a lot because I can look at my whole day and plan out my schedule. I can look at all my patients, read out their previous notes. If they're a new patient, I can look at their form, hopefully that they filled out, so I can prepare for them. I don't want to be blindsided by anything. And also, if you come in early, you can pre-write your notes, as in you can template your notes. So all you have to do is just fill out the information and then sign it in. Coming in early initially is going to be really helpful for you guys, especially to save on time. Some days will be really busy and you might get backed up, but if you come in early, you can really set yourself up for a good day. Number 11, learn to delegate. Delegate to your front desk, your secretary, even your colleagues. If you need help with something, if you need something scanned or emailed or you have a front desk for a reason, and it can only help you build a good rapport with them. And another thing is, if you have a call center or a scheduler, reach out to them and ask them, hey, can you make sure I only have like 3 intakes in one day? 4 intakes is really hard for me to finish. Or if you can schedule the intakes at the beginning of the day and not in the afternoon, because you're trying to finish the intakes, and it's hard to finish the intakes when they're in the afternoon. You might have to stay late. If they're scheduled in the morning, you have all day to finish them out, and then while you're doing your follow-up appointments. All right, guys, it's the Psych NP, and I'm out.